So, hello everyone, and welcome back to WINScience. This is part two of Why Do We Fall Ill. This is a smaller chapter compared to the last topic. So, we will be covering this through slides, and I will be explaining this in only two parts. Two parts are going to be longer than the regular usual lectures. So, be prepared. Have some cup of tea or some snacks, and then sit. If you guys are curious about what this thing is, so this is the temporary adjustment that I made for my mic so that I can express through my actions and you guys can catch up it pretty easily. So without further ado, we will start. First of all, subscribe to this channel if you guys are new. If you guys are old and you guys have been watching me since some time, you can share it as well as tell your friends about this channel. So, till last part, what we have studied is about some symptoms. We see a few symptoms when a person is ill, a person is sick. Also, we have seen a couple of things as well about some diseases and how symptoms can be similar in two or more diseases. This is also an important thing that we have studied. In this topic, we are going to study some MCQ based things. MCQ based things, so you cannot ignore this topic. This is highly important. Part 2s are usually more important than part 1, but like in this case, in this topic, first one is also important for your long answer type questions and stuff, and this is going to be important for your short answer type questions. So prepare both properly and have a separate approach. In the first section, I asked you to take your textbook and your notebook and make notes over here. You just need to watch this class again and just highlight the important things along in your textbook with a highlighter. Just highlight the words that are important according to you, and then study them for your Olympiads as well as for your board examinations. MCQs, fill in the blanks and select one word and stuff can come from this because there is a lot of new terms that will be introduced through this topic. So now we are going to proceed into the chapter. So in this part 2, we will be studying causes of diseases. What are causes of diseases? In the last class we discussed about what disease actually is. Disease means uncomfortable or like discomfort, and when one of the systems of our body messes up for the worse, we fall ill, we fall sick, and then disease is caused. We can say that we have certain disease, or we can say that there is some discomfort. What causes a disease? So this is another question. What actually causes disease? When we think about causes of disease, we must remember that there are many levels of such causes. For example, you have caught cough, so or like you have caught seasonal flu, or you have caught fever, or you have COVID. So there are various things that cause this disease. Even if the symptoms are similar, there are various things that are causing this disease. Let us look at an example. If there is a baby suffering from loose motions, we can say that causes of loose motions are probably infection. So if a baby, let's draw a baby over here. Even if it looks like a teddy bear, it is a baby, so he has loose motions. So this can be because of multiple things, like he has diarrhea, or like he has some stomach infections, he can have typhoid, he can have other diseases. So this is probably because of infection. But the next question is, now okay, before we start, I just want to say, in causes of disease there are a lot of question and answer. So you guys just need to stay as a link so that you don't miss out on any question, because these questions are kind of basic foundations of what you are going to study in the next subtopic. So the first question was what causes diseases. But the next question is, where did the infection come from? So the baby is infected, then where did the infection come from? Suppose we find the infection that the infection come from the unclean drinking water, but many babies must have this unclean drinking water. So why does the one baby develop loose motions while the other babies did not. So again, one more question: why did only one baby pick on disease, and why others were healthy as or like there was no disease in them? So what is the reason why other babies did not catch this disease? One reason might be the baby is not healthy. Yeah, baby is not healthy, so this is the reason why baby has caught the disease. As a result, it might be more likely to have disease when exposed to risk, whereas healthier babies would not. So let's compare this baby to another baby. So we can say that the other baby is quite healthy and strong as compared to this baby. Why is the baby not healthy? Now again, another question: why this baby is not healthy? Maybe because he's not getting enough food, or maybe because he has recently recovered from another disease. Perhaps because it is not well nourished. Let us assume that this baby is not well nourished and does not get enough food. So lack of good nourishment becomes the second cause of disease. Another important line: causes the uh, second cause of disease. Further, why is the baby not well nourished? Another question now comes. That the question is, why is baby not well nourished? Perhaps because it is from the household which is poor. Yeah, so NCRT tries to say that maybe because the household from where this baby we took comes from, this is the reason why baby is not getting enough food to eat, and because of lack of proper nutrition, the baby is falling ill and it is not healthy like other babies. It is also possible that baby has some genetic difference that makes it more likely to suffer from loose motions when exposed to pathogens. Yeah, it is a possibility that baby is slightly genetically different from the local babies out there, and this is the reason why the water that the baby drank is kind of okay for the kids, normal kids, but it is not okay for this baby that we took as an example. Without the pathogen, the genetic difference or poor nourishment alone could not lead to the loose motion, but they do not contribute but they huh, but they do become contributory cause of the disease. So yeah, what this line actually tries to say is, without the pathogen, the genetic difference or poor nourishment would alone not lead to the loose motion. So if there was, now what is this pathogen? Pathogen is something that causes disease is a pathogen. The pathogen can be a bacteria, a virus, etc. We will be learning about these things in next subtopic. But here, what NCRT is trying to say is that if the pathogen was not present, the baby would not have caught the disease. Just because of it is genetically different, and it is poor because of its poor nourishment. So what it is trying to say is that the main contributing factor behind this disease was the pathogen, but alone, just because it is genetically different and poor nourishment, would not make this baby a diseased baby. Why was there no clean drinking water for the baby? This is another question. Perhaps because the public service are poor where the baby's family lives. So there is a chance that baby is living in some poor area where the sanitation is not very good. The government is not taking care of the roads and pipelines. So poverty or lack of public service become third cause of the baby's disease. So see, now this is a very important thing. Poverty and lack of public services means the baby's parents cannot afford hospitals and stuff, and this is maybe this is because it is living in a poorer area, and this is the reason why baby is not healthy. It will now be obvious that all diseases will have immediate causes and contributory causes. So so it will be now obvious that all diseases will have immediate cause and contributory cause. So now what NCRT is trying to say, that on the baby, now even the smaller diseases can cause can cause harm to the baby. Also, most diseases will have many causes rather than one single cause. This is another important line, okay? Also, most diseases will have many causes. one disease can have multiple causes rather than just one single cause. Okay, so if a person is suffering from loose motion, there can be various reasons why a person is suffering from loose motions. There can be typhoid, there can be a maybe he has eaten some rancid food, or any other reason why. So like one disease can have multiple reasons why it is caused. Infectious and non-infectious causes. Now we will learn about these causes. What causes a disease? Now this is what we are going to learn. A group of causes is the infection. One group of uh, one group of causes is an infectious agent, mostly microbes and or microorganisms. Diseases where microbes are immediate cause are called as infectious diseases. Let me define it in a simpler way. Infectious diseases. These diseases are usually caused by infectious agent. So infectious diseases are usually caused by uh, infectious agent. Now this infectious agent carries the germs from one place to another, as well as this is what carries the infection to the baby. This is because microbes can spread in the community, and diseases they cause will spread with them. So as you guys have seen how the COVID was spreading from one patient to another, uh, like one person to another. This can be put into the infectious disease category, as an example. On the other hand, there are also diseases that are not caused by any infectious agent. So there are other diseases as well that cannot be caused by any infectious disease. This means these do not infect people, and these are not infectious. Their causes vary, but they are not external cause like microbes. Huh. Their causes vary, but they are not external causes like microbes that can spread in community. Instead, these are mostly internal, non-infectious causes. For example, cancers are caused by genetic abnormalities. Now, there are other diseases that are caused internally because of internal. These are caused internally, and these are not caused by is any external cause, and these are called as non-infectious diseases. And these non-infectious causes are the best example can be cancer. Now what is a cancer? Cancer is also a disease that is caused by genetic abnormality where the cells don't stop growing, and this creates a tumor. The way in which diseases spread and the way in which they can be treated and prevented at a community level would be different for different diseases. Another important line that NCRT states. Okay, I hope you guys are understanding what I tried to say over here and here. Some diseases are caused by infectious agents. These are usually these are called as infectious diseases, and examples are common cold. If one student from your class has cough, other 3-4 students get infected because of 3-4 kids. Now you guys this is winter going on, so you guys can practically see this thing. And it is how this infectious diseases spread. These spread from one person to another person by infectious agents. Now what are these infectious agents? These are microbes and microorganisms. Similarly, non-infectious are caused by internal cause. These are not caused by some external body. For example, cancer. Cancer cannot be spread from one person to another. The way in which diseases spread, the way they can be treated and prevented at the community level would be different for different diseases. Another important line: every disease is spread through different mediums, and they are treated differently as well. This would depend a lot whether the immediate cause are infectious or non-infectious. Again, how a disease is treated is dependent on whether the disease is infectious or non-infectious. If the disease is infectious, government directly puts on lockdowns and stuff, and this is how it is treated. And if it is not infectious, then there are other ways of developing medicines, vaccines and stuff. Infectious agents. Now we will learn about infectious agents, infectious diseases under this topic. Infectious agents. We have seen that entire diversity seen in the living world can be classified into a few groups. These classifications are based on common characteristics between different organisms. Okay, so what does this the first line say? We have seen that entire diversity of living world can be classified into few groups. So if so since you guys are in ninth standard, let me tell you whole lot of animals that are present in this whole world, all microorganisms, all living beings basically, this can be classified into a few categories. This classification is based on common characteristics between different organisms. Also, these categories of animals are based on their common characteristics. For example, fishes will be classified into other fishes category. For example, shark and whale can be classified into one category. So these are basically these characteristics. These are basically based on the basic characteristics of any living organism. For example, shark and whale live inside the water. This is why these are classified into one separate part. For example, lion, tiger, cat, these are very similar in characteristics, so these are classified into separate thing. Also, dogs, wolves, foxes, these can be classified into separate category. Similarly, microorganisms also can be classified into separate category. Now bacteria can be classified into different category according to their shapes. For example, there are rod shaped bacteria, there are spiral shaped bacteria, there are round bacteria, spherical bacteria. So this is how this can be classified into different organisms. Organisms that can cause diseases are found in wide range of such categories of classification. So the organisms that can cause disease are found in various categories. Yeah, there are various animals that cause harm to human beings, that cause diseases to human beings, and these are in a wide classification. Some of them are viruses, some of them are bacteria, some of them are fungi, some of them are single-celled animals. Now what are these single-celled animals? These are, okay, you guys haven't studied protistas, but I would like to say these are cells, basically cells that cause harm. And or protozoans are also cells, bacteria like organisms but a bit smaller. These cause harm. Some diseases are also caused by multicellular organisms such as worms of different kinds. Yeah, some of you guys might not be knowing, but there are different kinds of worms that live inside our body. Like if you are a diseased person, worms grow out in your body, and then there are various painful surgeries. You can just type on YouTube and watch if you guys have courage, but I would suggest do not watch. So what is this? This is a virus. If you guys don't know what is a virus, so I would just summarize it into a smaller thing. Viruses are not living, as well as they are not non-living as well. When a virus is inside your body, it is a living creature, and when virus is out of your body, it is a non-living crystal-like creature. So this acts as both. Also, let me tell you, when virus comes inside your body, it goes into the cell and then multiplies itself and then takes over your body, and basically you fall ill. Next, infectious agents. We are going to learn a few infectious agents that you guys, the NCRT has told you guys to study. So first is, you can see this picture, there is a colony of bacteria like this. So this is SARS virus. Now what is SARS virus? This is cousin of corona. SARS virus coming out arrows, for example. So yeah, there are these arrows you guys can see in your NCRT books. So these are arrows which show a SARS virus. This is 500 nanometers long. This is just measure of how you would measure a virus. Picture of staphylococci. So what is this staphylococci? This is just like a cheese ball type of virus. Sorry, this is cheese ball shaped bacteria. Basically, this is round shape. These are often found in groups, as well as sometimes not found in groups. Sometimes it is found in just a single, and sometimes it is in group of 3. Now what is this thing? This is a trypanosoma, the protozoan organism responsible for sleeping sickness. Okay, see, you guys see, this is a trypanosoma. This is your blood cell. Okay, blood cells are donut shaped, not donut shaped exactly, but kind of donut shaped. And this is trypanosoma. This causes sleeping sickness, so you will be sleeping all the time. Also, this staphylococcus causes acne and pimples. SARS virus causes nasal infection and cold. Okay, now this thing you can see. So what this thing is, this is picture of leishmania, a protozoan organism that causes kala azar. Kala azar. Kala azar. It is oval shaped and each has long whip like structure. So this is kind of like this. You guys can see a very similar thing. Okay, this is just basically description. You guys can read it if you want. Another very interesting thing, this is a adult ringworm. This lives inside your stomach. There is also something called as tapeworm that folds like a tape, measuring tape, and it stays in your stomach or like your intestine and feeds on the food that you eat and then scrapes out your intestine. This lives in small intestine. You guys can see how long it can be. It is 3.5 centimeter long. Common example of disease caused by the viruses are common cold, influenza. Influenza is flu. Dengue fever and AIDS. Okay, so these are some commonly virus. These are diseases that are caused by virus. Diseases like typhoid fever, cholera, tuberculosis, anthrax are caused by bacteria. So these are some bacteria. These are some diseases that are caused by bacteria. Again, very important thing. If you are preparing for any kind of Navodaya, or your Olympiads, or basically MCQ type, any exam that has MCQ type questions, this is going to be the one or 2 mark question probably. Many common skin infections are caused by different kind of fungi. See, fungi causes this type of reddish spots, and then this white colored skin basically scrapes off from this place. You can see this thing in candid candid powders ad. This is caused by fungus. Protozoan microbes cause many familiar diseases such as malaria, kala azar. So protozoans also cause something called as malaria. Malaria, you guys might be knowing. Malaria is really common in India. Also kala azar. Kala azar is a kind of disease. I don't know what it is. All of us have also come across intestinal worms infections, as well as diseases like elephantiasis caused by different kind of worms. So worms cause elephantiasis and stomach infections or intestinal worms. Why is it important that we think of these categories of infectious agents? Why is it important that we think of these categories of infectious agents? So now the question comes is, why do we think about these things? Why do we really need to know about these things? What are these things going to do in your life? Basically, these are going to infect you now or sometime later or someday, or maybe you are already infected or you are being infected, because there are millions of germs on your body. So you just need to know what kind of germs are there on your body and what precautions you need to take. Now NCRT gives a very good, real good reason why you should study this. The answer is that the categories are important factors in deciding what kind of treatment to use. So now NCRT says that why you need to learn this is because so that you know what kind of treatment is required. Members of each one of these groups, virus, bacteria, and so on, have many biological characteristics in common. You also need to know, see, we orangutans, chimpanzees have a lot of things in common. Similarly, uh, a sheep and a goat and a deer and a deer and other grass eating animals have some things in common. Similarly, these viruses and bacteria have a lot of things in common, and this is why you can give a very similar type of tablet for similar type of bacteria. Another thing, all viruses, uh, for example, live inside host cells, whereas bacterias very rarely do. Viruses, bacteria, and fungi multiply very quickly. Another important thing, while the worms multiply slowly in comparison, because worms are really large. This is why they reproduce and multiply very slowly in comparison to viruses and bacteria and fungi. Uh, there are a lot of there are a lot of infectious agents that just multiply a lot in number in just couple of hours, and then you fall sick. All bacteria are closely related to each other than to viruses and vice versa. So you can see bacteria in comparison to virus are really closely related that affect your body. This means that many important life processes are similar in the bacteria group but are not shared with the virus group. Okay, so what does this line mean? That a lot of biological processes that happen in bacteria are really close. So for example, let's take example of staphylococcus. There is another, let's say, a bacteria. Let's name this A. Let's name this A, and there is another bacteria. This lives in a longer chain, so let's name him B. So now these both have a very similar thing, similar life process, similar way of eating food, or similar way of putting food out of their body, similar way of producing energy. So as a result, drugs that block one of these life process in one member of the group is likely to be effective against many of the members of the group, but the same drug will not work against the microbe belonging to different. Okay, I got it. So now what your book tries to tell you is that let's imagine a medicine called as, let's call this medicine as penicillin. So now the penicillin works on this thing. So now you know that the penicillin is working on A, but and it is blocking its path to eat food. So this A bacteria will starve and die. So now what scientists do is that use the same drug on the B, because B is a really closely related cousin of A. So now they also can observe that B also starves and dies. So this is how one medicine can be used on multiple organisms. Basically, this is a very lame and rough example, but this is how I can explain. If one thing is curing monkey, for example, that can be used on humans as well, in a slightly different quantity, slightly more or slightly less quantity, but this is how things work. Antibiotics, they commonly block biochemical pathways important for bacteria. Many bacteria, for example, make make a cell wall to protect themselves. The antibiotic penicillin blocks the bacterial process that builds the cell wall. Okay, so antibiotics, what are antibiotics? Antibiotics kill bacteria. Antibiotics kill the bacteria. So what does this line state is that usually when you see, let's draw a cell, for example. Let's draw a cell so that I can explain you properly. So let's imagine this is our cell, and this is doing some biological activity where something comes from this side, then does a process like this, and then goes outside. Okay, so what do you do for the cell? If you want to kill the cell, basically you just block the thing over here. Let's just block the thing over here, or let's just block the thing over here, or let's just block the thing over here. By this blocking of a biochemical reaction, what you are indirectly doing is just stop breathing for some time, and then you will be observing what happens. This is how basically this works. You just choke someone, you just choke the bacteria, bacteria dies on its own. Similarly, let's take example of something called as penicillin. So penicillin, what does penicillin do? Usually the bacteria that live in free environment, they build a strong shell on them. This is called a cell wall, the wall to protect themselves. What does penicillin do? It does not allow this thing to happen. It keeps breaking the shell, and then the cell feels cold and then it dies basically. It is exposed to various things and then cell dies. This is how penicillin works. You just block the living process, you just block the biochemical process, and then cell will die on its own. As a result, the growing bacteria become unable to make cell wall and die easy. Human cells don't make cell wall anyways, so penicillin cannot have such effect on us. Human cells do not have cell wall, okay, because we are cells that are inside your body are already protected by the skin layer, so they do not need a cell wall, separate cell wall, to live. So, and also we are multicellular organisms, so we obviously don't need it. So that is why our cells do not get affected by penicillin, but what we want to kill gets killed. Another brilliant idea. Penicillin will have this effect on any bacteria that use such process for making cell wall. So now this penicillin, this thing can be used on multiple bacteria that make a cell wall. For example, you can use it on a bacteria that is making cell wall. Also, you can use it on another bacteria that is making a bigger cell wall, or making a cell wall that is different. So this is how one drug can be used to cure multiple diseases. Similarly, many antibiotics work against many species of bacteria rather than simply working against one. So there are there is a broad spectrum of diseases that one antibiotic can solve. So antibiotic is kind of a revolution to kill bacterial diseases. Okay, let's move forward. If we have a common cold, taking antibiotics does not reduce the severity of or the duration of the disease. Now one more thing that I want to tell: if you are having a antibiotic when you have a common cold, it is not going to work. Now why it is not going to work? The main reason why it is not going to work is because antibiotics kill bacteria and do not kill the virus. Common cold is a viral fever. That is why it spreads from one person to another. And because the common cold is caused because of a virus, and the antibiotic does not work on virus. However, if we also get a bacterial infection along with the viral cold is common cold, taking antibiotic will eventually help you. Even then, antibiotic will work only against the bacteria and will not interfere in whatever is going on with your common cold. So this is what it basically means. Means of spread. Now, why I am going a little bit faster? Because there are a lot of parts that need to be covered in a short duration. We are already at 33-minute mark, and I need to finish this in 1 or 1.5 hours, and I don't think it will get finished too easily, but if it gets, well and good. Means of spread. You guys can just go back 10 seconds and then forward if you are missing on any note. If you are taking notes, then I would highly suggest. If you haven't, then please take a notebook and start all over again, or just start from here. Means of spread. Now, how does a bacteria come into your body? How does a virus come into your body? This is a very important and interesting phenomenon, how organisms get to or get in your body. How do infectious diseases spread? Another important thing. Many microbial agents can commonly move from an affected person to someone else in a variety of ways. So, it is not that hard for an organism or a bacteria or a virus to go on you. There are various ways and there are various processes how organisms go. In other words, they can be communicated and so are called as communicable diseases. So the ones that can be communicated from one one person to another are called as communicable diseases, infectious diseases. Such diseases causing microbes can spread through air. Yeah, the common cold. When you sneeze, you are throwing out basically missiles full of viruses on your neighbors, on the person who is sitting on your side. So cover your nose while you are sneezing. This occurs through little droplets thrown out by the infected person who sneezes or coughs. So do not cough without your uh, handkerchief on. Someone standing close by can breathe in these droplets and microbes get chance to start new infection. So this is how they travel from one house to another. One house means one body to another. Example of such diseases spread through the air are common cold, coronavirus disease, pneumonia, and tuberculosis. For the ones who don't know what is tuberculosis, it is usually called as TB in India. This is also a communicable disease. So yeah, you should avoid spitting on roads, or also avoid the person. Also tell the person who's sitting near you who is spitting continuously to avoid this thing. Maybe he might have tuberculosis and it might just creep on. Just climb on you. Pneumonia is infection in which water fills in your lungs. Water fills in your lungs. COVID-19, we all know, lockdown. 2 years of your life. Means of spread, another, the similar topic that we are studying. We all have had of experience of sitting near someone suffering from cold and catching it to ourselves. Everyone has had this thing at least once. Obviously, the more crowded our living conditions are, the more likely it is that such airborne diseases will spread. So the more obvious, it is really obvious that airborne diseases spread from air to air. And when you are sitting near someone who has cold, you are definitely going to catch it. So this is a man spitting. Okay, small droplets evaporate and two droplets nuclei in this zone. So this is where some evaporation happens and some still continue forward. Some droplets that are faster will eventually go and then go into the ventilation or just go in air. Larger droplets will fall to 2 meters of distance. Some of them might go to 4 meters of distance. So this is how it is. And the droplets that are carried with air, God knows where they go. They might go kilometers far, who knows. Diseases can also spread through water. Okay, a lot of diseases are spread through water. For example, typhoid. This occurs also amoebiasis. This occurs if the excreta from someone suffering from infectious gut disease such as cholera get mixed with the drinking water caused by person living nearby. Okay, let's draw a diagram and then I will explain you guys. This is river. Okay, here there is a boy. Let's call him Chintu. No, he's not cute. He's just a boy, stickman boy. Okay, now he is suffering from a really bad stomach. Okay, so what he does is he goes near the water and then starts pooping. Okay, here is a bush and here he is pooping. So what happens is the poop goes into the water and then spreads here. Then okay, here is a woman whose name is, let's call her ABC. So she is washing her clothes or probably cleaning her utensils. This is the best example. She is cleaning her dishes. Okay, now this infection climbs on this dish. Then this woman carries it to her house. Let's draw her house. And then her son also gets the similar infection. This is really common. So yeah, you must drink cleaner water. You can have some infected food, but always have a cleaner drinking water. The cholera causing microbes will enter the healthy person through the water they drink and cause disease in them. Such diseases are much more likely to spread in absence of safe supplies of clean drinking water. This is very common in places. This is very common in India as well. So have clean drinking water at least. or at least boil the water that you have. Now, the sexual act is one of the closest physical contacts two people can have with each other. Now, there are a lot of diseases that caused by sex. Not surprisingly, there are microbial infections such as syphilis or AIDS that are transmitted by sexual contacts from one partner to another. However, such sexually transmitted diseases, these are called as STDs, are not spread by casual physical contact. So there are some diseases that are caused by sexual activity, and these are not caused by just physical contact, like touching a friend or just keeping hand on shoulder. These are not caused by these things. These are caused by physical contact. Sorry, these are caused by sexual contact and not by any physical contact. Casual physical contacts include handshakes, hugs, sport like wrestling, or by any other ways in which we touch each other socially. Other than sexual contact, the virus causing AIDS, HIV. HIV is human immunodeficient or something virus. Human immuno HIV, something I don't know the full form, can also spread through blood to blood contact with infected person or from infected mother to her baby during pregnancy. Okay, so this thing HIV, let me just google the full form for you guys. I have my laptop on. Okay, I was correct. HIV is human immunodeficiency virus. So this HIV virus, this is caused by sexual contact as well as from blood to blood contact. Blood to blood contact also comes when a child is born. If mother has HIV, the a son or daughter, the offspring that is born might catch HIV. So this is blood to blood contact. Also by sharing the syringes. What is syringe? Syringe is injection. From one injection, if a person does not use a fresh injection, a doctor, then there is a chance of HIV spreading from one person to another through breastfeeding. Now, what is breastfeeding? When mother is feeding her child, there is a chance that the child might get infected by HIV. So this is what is about the sexually transmitted diseases. This is a very, very important thing. Sexually transmitted diseases, these are called as STDs, and these are spread by sexual contact. Next, now there is a very, very important picture that shows how multiple diseases can be transmitted from one person to another. Okay, so this is infected person and this is healthy person. When a person spits or sneezes, it goes. Okay, these are not just sexually transmitted, these are overall entire map of what we just saw. These are caused by air. These are caused by direct, or you can see the girl and boy kissing. So this is direct contact. So this is how some diseases get transferred. Also indirect contact. What is indirect contact? By using clothes. Fungal infection spread when you use other person's clothes. So never ever use other person's clothes. By food means when you share your food. Mosquito or insects, yeah, the fly sits on the poop and then sits on vada pav or whatever you guys are eating outside, and then you eat the same food. This is how it also gets spread. Also through rabid animals. What are rabid animals? Stray animals also cause diseases. Okay, let me just increase the thickness of my pen. Okay, fine. So this is how things work. I hope you guys are understanding till now. We are into the class and 44 minutes. I would highly recommend subscribing now because you guys might forget. Take a 1 minute break. Not even 1 minute, just have some food. Okay, now we are back again. Not even 1 minute break, sir. It is okay, it is fine. This is probably the longest lecture that I have recorded. I hope this becomes the longest lecture. I don't think it is the longest lecture. We live in an environment that is full of many other creatures apart from us. Obviously, there are cats, dogs, rabbits, etc. It is inevitable that many diseases will be transmitted by other animals. These animals carry the infected agents from sick person to another potential host. What is this potential host? Potential host is weak immunity person. So animals might also take a disease from one person and just spread it to another person. Like like I don't know which disease, but there might be some diseases. Common cold can also spread from one animal to another. If the cat is infected, if you sneeze on the cat, these animals are thus intermediaries and are called as vectors. Vector spreads one disease from one person to another. Let's draw a small map. Infected person, safe person or healthy person. Now disease spreads from vector. So this is how the map is. This is just for your understanding. The commonest vectors we all know are mosquitoes. Okay, we got the example of mosquito. In many species of mosquitoes, the female need highly nourished food in form of blood in order to be able to lay mature eggs. Mosquitoes feed on many warm-blooded animals, including us. In this way, they can transfer disease from one person to another. Yes, now I remember. Okay. Have you ever guys heard about malaria? Malaria is also caused by mosquito. Dengue is also caused by mosquito. So this is caused when a mosquito sucks the blood of person who is infected by malaria and then goes on your body and then sucks blood from your body. The salivary gland of female mosquito has these vectors, and then these vectors have these germs of malaria, and then these go into your body, and then you get infected by malaria. Organ specific and tissue specific manifestations. Now there are some diseases that are organ specific and tissue specific. Now we are going to learn them. Disease causing microbes enter the body through these different means. Where do they go then? So now where do they go then? In case of malaria, it goes into your liver first, then it multiplies itself, then it comes to the blood. The body is very large when compared to the microbes. Yeah, microbes we can't see with your naked eyes, and body is this huge thing for them, probably Burj Khalifa for them. So there are many possibilities. Sorry. So there are many possible places, organs or tissues where they could go. So there are various places where these organisms, या फिर what do we call them, these small vectors or small disease causing bodies, bacterias go, viruses go. Do all microbes go to the same tissue or organs, or do they go to different ones? Obviously they go to different ones. This is why this thing becomes quite important. Different species of microbes seem to have evolved to home in on different parts of the body. Okay, so different disease causing things go to different bacteria go to different parts of your body. In parts, this selection is connected to their point of entry. If they enter from the air via nose, they are likely to go in lungs. Okay, so it really depends on where these things are coming from, or from which point do they get into your body. If something is getting into your body from skin, it is going to most probably stay on skin. If it is going through your nose, it will go to your lungs and affect your lungs. This is seen in bacteria causing tuberculosis. Tuberculosis is caused in lungs, so it goes into your lungs. If they enter through mouth, they can stay in your gut lining. Okay, typhoid, which is caused by dirty water, This stays in your stomach and your intestines, like typhoid causing, okay, I'm quite smart, I guess, causing bacteria. So the NCRT also gives example of the typhoid. Or they can go to the liver, okay, so typhoid can also go to the liver once it crosses the intestine, cuts through the intestine, like the viruses that cause jaundice. Jaundice is caused by really when your liver is really infected. So jaundice goes to your liver first. This can come in your MCQ if they want, if the exam is really hard. If it is not, then it is not going to come. But this needn't always be the case. An infection like HIV that comes into the body via sexual organs will spread to lymph nodes all over the body. Malaria causing microbes, okay, so HIV will go into your lymph nodes. If a person is infected by HIV, the HIV virus goes to the lymph node. What is lymph node? Okay, so let me tell you. Every organ or every body part cannot get blood just through blood and capillaries. There are some cells deep down, or there are some muscles deep down that need nourishment. So these things are nourished by another system that is called as limbic system. So lymphic system is responsible for feeding them, but this uses this does not really use blood, but this uses plasma like substance that moves through the cells, and then gives nourishment to the cells that are deep down. So it goes into the lymph node. Malaria causing microbes enter through the mosquito bite and will go to the liver. See, I already told you. And then to the red blood cells. So it first comes, then goes to the liver, and then from liver it goes to the red blood cells. The virus causing Japanese encephalitis, okay, the virus that causes Japanese encephalitis, encephalon means brain, so, or brain fever, this can also be called as brain fever, will similarly enter through the mosquito bite, but it will go to the brain and infect the brain directly. So Japanese encephalitis or the brain fever, the virus directly goes to the brain. Okay, this is what we have come so far. The sign and symptoms of the disease will thus depend on the tissue or organ which the microbe targets. So now the signs and symptoms that a thing shows or a disease shows are highly based on from where this thing is coming from, or from which part is it infected. For example, when you have typhoid or really serious typhoid, you guys might poop blood, or like there is severe stomach pain, and really wild contractions of stomach. These can be seen in typhoid. Similarly, and also weakening. Similarly, if the virus has infected your lungs, then you see coughing, a lot of fluid in your chest, a lot of cough, and this is what you see when you see that the lung is infected. So most of the symptoms that you see come from which organ is usually affected. If the lungs, okay, I just explained you this thing. Okay, so these are some functions that are shown, or some symptoms that are shown. If you want to read, you can just go on your NCRT and read this thing. In addition to these tissue specific effects of the infectious diseases, there will be some other infections, some other effects too. It is just not about where the infection is. There are some infections that might be seen in a different part of your body. Most of these common effects depend on the fact that the body's immune system is activated in response to the infection. Also, the body has its own soldiers. It is called as immune system. So this also gets to the work once it notices that there is some growth of bacteria or any pathogen that is causing infection. An active immune system recruits many cells to the affected tissue to kill off the disease causing microbes. So Once your immune system gets activated, it recruits a lot of soldiers so that it will just go punch out and just throw the infection out of your body. This recruitment process is called as inflammation. Okay, so you guys must have seen there is when you get let's take example, you fall from your bike and then you get a scratch. The scratch also gets inflamed. Why does it get inflamed? Because the defense system of your body, that is immune system, is acting on the wound and then killing the bacteria present over there. As a part of this process, there are local effects such as swelling and pain. So you guys can see swelling and pain even when you guys have this pustules, means there is a pimple with the pus. It also causes some inflammation. This is because of the same reason. General effects such as fever, you also get swelling and fever and pain. You can feel severe three things very very severely. In some cases, tissue specificity see of the infection leads to very general seeming effects. There are some really really normal effects sometimes, that is a little bit cold, little bit chills sometimes. For example, now there is another really serious example. For example, HIV. In the HIV infection, virus goes to the immune system and damages the function. So now this HIV virus directly goes into the immune system and starts eating away the immune system. Thus many of the effects of HIV/AIDS uh, are because the body can no longer fight off the minor infection. So because of the HIV/AIDS virus, your body just cannot fight the normal or small infections like fungal infection and common cold, and patients usually die by these smaller things. Instead, very small cold can become pneumonia. So because of your weak system, because of this HIV thing, your infection so because of this small thing of HIV, because of this HIV, the small disease can also convert into a larger disease and then affect you. Similarly, a minor gut infection can produce major diarrhea with blood loss. So just small stomach infection of typhoid might cause uh, blood loss as well. Ultimately, it is it is these other infections that kill the people suffering from HIV/AIDS. So the people who are suffering from HIV/AIDS are usually get killed by smaller infections and not by HIV/AIDS. It is important to remember that the severity of disease manifestation depends on the number of microbes in the body. Also, how severe a disease is, it highly depends on what amount of microbes are present. If you have, let's imagine 10 million, 100 million, and there are just 10 million common cold viruses, the severity will be high over here than severity over here. And this will also tell you how much severe the infection is going to be and how your body is going to react differently. If the number of microbes is very small, the disease manifestation may be minor and unnoticed. You won't even understand what is happening and what your body is doing. But if the number of say microbes is large, the disease can be severe enough to life threatening. Okay, so if there is significant number of common cold virus, you guys might just land on your bed and not get up for like 2-3 hours. And if the manifestation is small, then you guys just would feel a little bit of drippy nose and then you guys will be fine. The immune system is major factor that determines the number of microbes surviving in the body. Also, immune system is the major factor that determines the number of microbes surviving in the body. So if you have a stronger immune system, there will be less microbes, obviously. We shall look into we shall okay, dumb joke, sorry for the lame joke. We shall look into this aspect little later in this chapter. So in this chapter, at the end of the part, we are going to see this. Now another subtopic, but we will have a small pee break. Bye bye. Ladies and gentlemen. Okay, so come back to your class fast. Now we are on a last or second last topic. It is principle of treatment. How do you treat the infections? Now we have learned about how infections spread, what infections are, what symptoms are. Now we are going to learn how do we treat the infection. Answer is very simple: give medicines. But how? What are the steps taken by your family when you fall sick? What does your family do when you fall sick? Your dad gives you medicines and your mom panics sometimes. This is what happens at my place. How do you have you ever thought why you sometimes feel better if you sleep for some time? Ever wondered why you feel better when you sleep for some time? This is because sleep acts like a repair mechanism. A lot of repairs inside your body start faster when you sleep, and then you feel better. This happens when you have a heavy fever, you just sleep and wake up healthy. When does the treatment involve medicine? Obviously, when the thing goes beyond mummy's or your dad's hands, when infection is above the level of when the infection is above the level of home remedies, that is when I personally visit the hospital. Based on what we have learned so far, it would appear that there are two ways to treat an infectious disease. So there are multiple ways of treating disease. So we will be learning a few ways of treating the infectious disease. One would be reduce the effect of disease, and the other will be the kill the cause of disease. First is to reduce the effect, okay? Because you just cannot. Let's imagine you have a common cold infection. You just cannot kill a virus, okay? So what you do is give medicines to sober the effect of, let's say, your head is you have headache or severe migraine, or you have throat infection. So what you will do is give the medicine to cure the sore throat, or to kill the virus colonies in your neck, or like give medicine for headache, but you just cannot kill the virus. And when you have a bacterial infection, you can just give the antibiotic and kill the bacteria. For the first, we can provide treatment that will reduce the symptoms. The symptoms are usually because of the inflammation. So let's take example: you have a wound and it is inflamed. So what you do, you cannot kill the wound or something, or you just cannot kill the bacteria over there too. So what do you do is just give anti-inflammatories. Also, this is how in simple terms I can explain. For example, we can take medicines that bring down the fever, reduce the pain, lose motions. We can take bed rest so that we can conserve our energy. So when you are in bed, your body goes on a repair mode. This will enable us to have more of its available focus on healing. This is how our body heals. But this kind of symptom direct treatment by itself will not make the infecting microbe go away, and the disease will not be cured. Yeah, if you have a really severe infection and you take a rest and then heal, but the germs do not go completely. It takes some time, and you need to kill the germ in order to make your body disease free. For that, we need to be able to kill microbes. So you at the end of the day need to kill these microbes to have a healthy life. How do we kill microbe now? How do we kill the microbe? One of the way is to use medicine that kill microbes. We have seen earlier that the microbes can be classified into different categories. There are viruses, bacteria, fungi, or protozoa. These all are microbes that harm your body. Each of these groups of organisms will have some essential biochemical life processes. We just block the biochemical process, and the bacteria or the virus or anything that is living will die, which peculiar to the group and not shared with the other groups. Okay, you need to catch some unique process that is not in any other group, so that you can just put antibiotic or something and just get rid of with whatever infection is there. These process may be pathways for the synthesis of few substances or respiration. Also, these processes should not be done by your body as well. If there is XYZ process that your body is also doing, and the germs body is also doing, so it is going to harm your body as well. So better just choose a unique process that is just unique to the organism that has infected you, so that your body is safe, the organism is getting killed. For example, our cells make new substances by mechanism different from the used in bacteria. We have to find a drug that blocks the bacterial synthesis pathway without affecting your own. Yeah, otherwise your body is also going to get harmed. This is what is achieved by antibiotics. Okay, so now this is what it basically tells about antibiotics. One reason why making antiviral medicines is harder than making antibacterial medicines is that viruses have few biochemical mechanisms of their own. So basically virus is like a chip that is inserted into the cell, then the cell activates, and then cell just becomes enemy of your own body. So virus has very little mass of itself, or very little genetic, very little organelles of itself, and this is the reason why killing bacteria is pretty harder. They either enter our cell or use our machinery for their life process, and this means that they are relatively few virus specific targets to aim at. So this is why killing a virus is really hard. Despite of this limitation, there are now effective antiviral drugs. For example, the drug that keeps HIV infections under control. So there are some things that genuinely help you in easing out the effect or suppressing the effect. So these can be considered as virus killing drugs, or whatever these guys called antiviral drugs. Principles of preservation. What do we mean by this? All of what we have talked about so far deals with how to get rid of infections, which we studied just 2 to 3 minutes ago. If someone who has disease, so this is for the someone who is having disease, but there are 3 limitations of this approach dealing with infectious diseases. So there are multiple approaches to deal with the similar thing. So what are these approaches? Let us learn. The first is that once someone has disease, their body functions are damaged and may never recover completely. So and will never recall. So there are some functions that will be damaged forever because of this treatment, and these will never ever recover properly. Second is that treatment will take time, which means that someone suffering from the disease is likely to be bedridden for some time, even if we can give proper treatment. So there are some things that take time longer than usual to heal. This is what. And the third is that the person suffering from an infectious disease can severe as source where the infection may spread to other people. So there is also a chance that the infection might get spread, like the COVID. This leads to multiplication of above difficulties. It is because of such reasons that the prevention of disease is better than its cure. So you just need to so because of these multiple complexities that are caused by just one disease, you can just cure it. You can just prevent it rather than curing it. So you can just prevent the disease so that you don't have to suffer so much. This is what the line is basically trying to tell you. How can you prevent the disease? Now, how do you prevent this disease? By developing a stronger immunity. There are 2 ways, one general and one specific to each disease. The general way of preventing infections is most related to preventing exposure. The best way to cure a disease is stopping your body from exposing to it. avoid communication with avoid exposure with the disease. Now, how do you avoid it? By putting a lockdown. Simple. How can we prevent exposure to infectious microbes? How do you prevent the exposure to infectious microbes? By putting on masks, by washing your hand with with hand washes and cleaning with sanitizers. If we look at the means of their spreading, we can get some easy answers. If we look at a COVID, for example, COVID spreads from hand to hand or like through air. So um, what we can do is put gloves before touching the patient, or like put on masks when you are in public places. This is what we actually did. I don't really need to explain what we all did. For airborne microbes, those carry droplets, we can prevent exposure by providing living conditions that are not overcrowded, maintaining appropriate physical distance. What do we call it? Social distance. Wearing appropriate mask, M95 something, N95. Practicing hand hygiene, putting sanitizers. These are so obvious, and we have been through this thing. For waterborne microbes, we can just clean the water, boil it. We can just pasteurize it, or just use a RO, the RO that we have in our house. You can use the similar thing. So we can have public hygiene. Also, avoid stagnant water, or just avoid having stored water in open areas. Immune system of our body is normally fighting off microbes on a daily basis, continuously till you die. We have cells that specialize in killing infecting microbes. These cells go into action each time infecting microbes enter the body. So this thing keeps happening. Whenever the bacteria tries entering your body, the body fights with it. If they are successful, we do not actually come down to any disease. When your immune system is very very successful, then you don't really have any disease as such. You are considered healthy. But if your defense system, if your immune system is not able to successfully do their job, you land up in a hospital in a bed, and you land up diseased. The immune cells manage to kill off infections long before it is assumed to be a major proportion. So before even before you knowing that you are sick, your body is obviously fighting for you. As we noted earlier, if the number of infecting microbes is controlled, the manifestation of disease will be minor. So the manifestation or the effect of disease will be pretty much low. If, in other words, becoming exposed to the infected with an infection does not necessarily mean the developing of noticeable disease. Okay, this is what basically the line means, that so just getting exposed does not mean that you are sick now. Your immune system is quite able to fight. So one way of looking at the severe infection disease is that it represents the lack of success of the immune system. The functioning of the immune system, like any other system in our body, will not be good if the proper and sufficient nourishment of food is not available. If the food is not available, your body is not going to fight for you. Therefore, the second basic principle of prevention of infection disease is availability of proper and sufficient food for everyone. So food for everyone is the best thing that can be used to develop the healthcare as well. If you think in another way, if the citizens of country are getting enough food, getting enough nourishment, you don't really need to visit hospital tens of times, or you don't really need to build government hospitals. If the society is healthy enough and getting enough immunity and enough nourishment. This is what this thing basically means. There are general ways of preventing infections as well. What are specific ways? They are related to peculiar property of immune system and usually fights the microbial infections. Let us cite an example to try and understand this property. These days there are no smallpox. Okay, let's discuss about the smallpox thing. What is this smallpox thing? There was a time when kids used to get infected by smallpox, which is not there right now. But the citizens of Earth, or humans have got rid of this smallpox, and this is because we have developed the immunity against it. So anywhere in the world, but it is recently hundreds of years ago, smallpox epidemic was not at all uncommon. In such epidemic, people used to get very afraid of coming near someone suffering from the disease, since afraid of catching the disease. Okay, so this there was a smallpox phenomenon, just like we had a pandemic, there was an epidemic. Now uh, this was a disease which had the pox used to grow on your body, small pustules, and the pus used to come out of it, and this used to look pretty ugly. Also, this used to kill a lot of people. So this was a havoc before the vaccine came out. However, there was one group of people who did not have this fear. These people would provide nursing care for the victims of smallpox. This was the group of people who had smallpox earlier and survived it. So now, what does this thing say? That okay, there was a group of people who had smallpox in their childhood, and then they had survived the smallpox, and now they had the immunity to fight against the smallpox. And these people were the ones who did not ever get infected because their body's immune system already had defeated the smallpox in smaller quantity and gained the immunity over the smallpox. So these people used to help the people who are diseased by smallpox. Although with a lot of scaring, in other words, if you had smallpox once, there was no chance of suffering from it again. Similar with the chickenpox, if you had chickenpox before, you are never going to have chickenpox in your life. Probably never ever. So having the disease once means the preventing subsequent attack of the same disease. Once your body learns how to kick disease away, next time when the disease attacks you, your body knows how to kick out the disease. Once you have corona, next time infection just does not last. Remember, when you took the first shot of vaccine, you were dead. Yeah. The second shot of vaccine, you were pretty fine because your body had known how to fight. And when you had the booster dose, just nothing happened. And if you unluckily did not have corona, it is a very good thing. But if you had corona after that, just nothing just happened. But if you had corona at the first place, your body did not know how to fight, and it took a lot of strength of your body, and a lot of people lost life. Yeah. But your body took a lot of pressure at the first place. So if you had vaccines and then corona, nothing happened. But directly, if a person was infected by corona, most of them did suffer, and some of them suffered really bad. Traditional Indian and Chinese medicine. Okay, you guys can read this. Okay, this is quite interesting. If you guys want to read it, you can read it. Let's see how much part is remaining. Okay, we have a significant portion that is remaining. So why does this vaccine thing happens? Let us learn why this vaccine thing actually works on your body. This happens. Okay, I would just make a small 10-minute lecture after this to explain whole vaccination thing. So we are into the lecture, 1 hour 19 minutes, and it was a quite fast-paced lecture. So make sure you guys are watching it again. Also, please subscribe and see you in the next class. Bye bye. Next class is going to be on vaccination. I will tell a whole story and explain this chickenpox thing again. If you guys are interested, if you guys find any value in this lecture, which you already did, then hit the subscribe button and let me know what you guys want to learn next. See you in the next class. Bye bye.